So riboflavin, vitamin B2, is essential for brain membrane stability and the maintenance of energy in the brain. This particular B vitamin is safe with no upper limit set that is not found to cause harm. For example, vitamin B6 does have a safe upper limit. A well-designed randomized controlled trial evaluated riboflavin for migraines. They used 400 milligrams of riboflavin. This is more than you'll find in a standard multivitamin for 3 months, and it resulted in a 50% reduction in attacks in 59% of patients. This is a huge amount of relief for a safe vitamin. The placebo eased them. 15% of the people had relief with the placebo, but 50% of the people who took the riboflavin had a reduction in attacks, a 50% reduction in attacks in 59% of people. In other words, a huge reduction. Chances are this could be helpful for you. How does riboflavin work? It plays a vital role in the elimination of toxins and drugs. And as I mentioned, many drugs can increase migraine frequency and severity. Riboflavin is needed to recharge antioxidants. If you get a lot of oxidation in the brain, this and inflammation are tightly related. Inflammation leads to oxidation, and oxidation can lead to inflammation. So reducing inflammation by recharging glutathione is one of the ways riboflavin can reduce headaches. I mentioned that riboflavin is essential for energy production, and it can reduce inflamed brain membranes. Remember, that's part of the process of migraines. And you may have noticed that many people with migraines have a sensitivity to light. And so hiding under a blanket for hours or days cuts down on that light. Riboflavin reduces sensitivity to light. And in fact, one of the deficiency symptoms of riboflavin deficiency is sensitivity to light. Now I'm going to talk about CoQ10 for a minute. Coenzyme Q10 is essential in energy production. We make it in our bodies. We may not make enough. They tried it on 31 patients with migraines. They used 150 milligrams daily of CoQ10, which is not a large amount. We used CoQ10 in our Hawaii dementia prevention trial as well. So 61% of the migraineurs had a 50% reduction in migraine days without significant adverse effects. I've seen CoQ10 used in many studies for many problems, and adverse effects are not common. Of course, because we make it in our bodies, it's a normal thing for our bodies. Supplementation was effective within the first month of therapy, and it also could be helpful for pediatric migraine. Unfortunately, kids get migraines too, and CoQ10 may be a safe way to do that. This is from the study encephalgia. It's called Open Label Trial of Coenzyme Q10 as a migraine preventative. Another study, 4 months of treatment, showed promising results for prevention of migraines in adults. So again, CoQ10 is for prevention, not for treatment. And the American Academy of Neurology concluded that Coenzyme Q10 is possibly effective for migraine. And this is a real coup because they don't say that lightly. It's not a drug. One more, alpha lipoic acid in migraine, 29% reduction in migraine attack frequency. Alpha lipoic acid is not an essential nutrient, but it might increase energy production in the cells. And they use a rather large amount, 600 milligrams daily for 3 months. I can't stop without mentioning vitamin D. It reduced attacks in this study. They used 2,000 IUs of vitamin D for 2 months every day, and then they reduced it to 800 IUs. This was in children with migraines, and it really helped. It reduced attacks per month from 12 to 5 and cut the severity in half. A tremendous effect. Not all studies on vitamin D show this big of an effect. Here's another pretty picture. This is in the Sea of Cortez, a place called the Waiting Room. So I will just have one more section. I'm going to talk about reducing inflammation. Omega-3s are very important. Omega-3s reduce inflammation, and certain omega-6s, excesses, or the arachidonic acid form from animal fat increase inflammation. They increase inflammation and pain, so we want to reduce that. And after 12 weeks, patients who had both reduced their omega-6 and increase their omega-3 had a nice reduction in their greater improvement in their migraines. The omega-6 thromboxanes can also constrict cranial arteries, helping to trigger a migraine. This subject is rather complicated, and if you want to know more about omega-3s and omega-6s and all of their metabolic products, you could read my textbook, also on my website, drsteveblake.com, also for under $10, Fats and Oils Demystified. And in this, I talk about how omega-3s and omega-6s work. So the omega-6s, whether from excessive food oils or from turkey, chicken, eggs, and other animal fat, create arachidonic acid in our bodies, which are processed by this lipoxygenase enzyme to create pain and inflammation. On the contrary, flax seeds, if you grind up organic flax seeds and eat a tablespoon to 2 tablespoons per day, they reduce pain and inflammation through a similar pathway, but opposite effect. So the Advil and the Celebrex are there to block the cyclooxygenase and lipoxygenase enzymes that create pain and inflammation, or you could just not eat arachidonic acid by avoiding all animal fat. So we can just eat the omega-based omega-3s and the omega-6s and make the right amount of EPA and arachidonic acid if we're well nourished. And again, my book, Fats and Oils Demystified, available here on my website, can tell you all about that if you're interested in this subject. Also, chia seeds and hemp seeds are helpful with omega-3s too. Quercetin is found in all of these wonderful foods, red onions and red grapes and apples and berries and beans. And quercetin also reduces phospholipase to reduce the amount of inflammation in the body. Turmeric is very helpful to fight inflammation, and also the cruciferous vegetables such as kale, cabbage, green tea, and Brussels sprouts and broccoli. Green tea, of course, is not a cruciferous vegetable, but it got in this list. They can inhibit inflammation, and quite powerfully. Unfortunately, there are foods that increase inflammation. The endotoxins that are found in meat, chicken, and dairy products, 2 hours after a meal high in animal saturated fat, inflammation is raised in the entire body. Our immune system sees these endotoxins, and our immune system has surveillance cells. They're called, there's two different, they're not actually cells, they're receptors on cells. And the cluster of differentiation 14 is the one that on the blood-brain barrier senses these inflammatory substances and triggers inflammation in the brain. And toll-like receptor 4 is a cell receptor that senses that you've eaten animal products and increases inflammation throughout the entire body, because they're worried that you have an inflammatory attack of bacteria. What can you do? Well, don't eat animal fat. Glutamate is the chief exciting neurotransmitter, and I do want to mention that there's a substance in it called apigenin, substance in certain plants called apigenin, such as passion flower and chamomile, and hispidulin in skullcap, that reduce this excitation of the brain. As I mentioned, be careful with skullcap. It can make you sleepy, take only before bed. And passion flower also can make you relax or even a little sleepy. And chamomile makes a wonderful tea that can reduce the excitatory neurotransmitter. And this is from a journal Drugs, and the title of this is Glutamate Receptor Antagonist in the Management of Migraine. In other words, they block the glutamate. Apigenin, again, is found in passion flower and chamomile, and it can block the kainate receptors to prevent generation of migraines. Anti-excitotoxicity effects, also very valuable in epilepsy. Hispidulin is another plant flavonoid found in skullcap and rosemary. Rosemary is a wonderful addition to food. You can use it as a spice. And I mentioned skullcap as a tea, use the leaves and take it only before bed. They enhance the brain quieting neurotransmitter GABA. So to sum up, talk, and thanks for your patience in listening to this comprehensive survey of safe, well-researched ways to reduce your migraine pain and frequency. Learn your triggers, whether they're foods or odors. Learn your triggers. You may want to use an elimination diet and a migraine diary so that you can identify your triggers. Make sure to get good sleep with no skipped meals, because those are very common triggers for migraines. You can consider ginger root tea instead of the ginger powder that's used in the studies, or the ginger powder. And you could put some skullcap leaves in the ginger root tea if you're drinking it before bed. Ginger root tea is typically made by decocting it. In other words, you slice the ginger root up fresh, put it in water, and simmer it at very low heat for perhaps 10 or 20 minutes until you get a spicy tea that can be sweetened. To reduce excitation of your brain, use stress control techniques, avoid stressful situations that can trigger a migraine. I know that's not always easy or possible. I talked about feverfew and butterbur without the pyrrolizidines, and those can be very helpful and have been found to be in clinical trials. Magnesium is crucial, and vitamin B2 for migraine reduction in frequency and severity, and Coenzyme Q10 can be very helpful. And regular aerobic exercise is good. I took a run yesterday to keep my aerobic exercise up. Remember, you might be able to reduce your migraine frequency from 3 migraines per week to 1 every other month, or perhaps even dream to eliminate them. Skipped meals are a trigger for 56%. Remember not to skip those meals. Avoid perfume and paint fumes. Try and lose weight. If you're overweight, that can really help. Watch out for histamine in things like red meat and beer. And ginger powder resulted in 44% of people migraine-free. Vitamin B2, 51% had a 50% reduction. Coenzyme Q10, again, almost 2/3 had half the migraine days. And butterbur knocked it down to half the frequency of migraine.